Gina, it looks like you're still muted.
Okay, sorry. Let me start over. Okay, Miriam Cummins, Sonia Nepler, Greg Soriano,
Present.
Robin Davis,
Here.
Jamie Jones, Keith Coco,
Here.
and Stephanie Newton.
Here.
And I'm here, by the way. This is Miriam Cummins. Sorry, I'm a little bit late.
Okay.
All right. So let's go ahead and do business in public. And Matt, I'm going to go ahead and pass it over to you.
Okay. So I'm Matt Harrington. I've met some of you before, but I'm the communication and engagement officer with the city. And I'm coming to you tonight to give you a sneak preview if it's something that the HRC wants to maybe be involved in. But in a conversation with Millie at the library, we were doing some new signage of the Spanish material collection. And she explained to me that back in 2019, right before the pandemic started, they had a goal of creating a mural on one of the walls that's adjacent to the collection. And the reason it came up was that they had this tiny little sign that said materiales en español. And it was like at the back of the little area or whatever. And I was like, that seems kind of lame. And so we started talking, and basically kind of the thought evolved from in other areas of the library, they have just like information in big text on the wall. And we're like, well, we could put, that would draw attention. And then she started talking about the mural project. So I'm hoping that we can resurrect that via the Arts Commission. But I also thought maybe if there were people that were interested from the HRC, and then I know Millie also said something about originally they were talking about involving the high school art classes as well. So there's like a million different directions this thing could go in, as far as like you could have a contest, or you could, just involve the art classes, or I don't know. It's like I said, it's a definite like sneak peek genesis of an idea, but I just wanted to like let you guys know that it's on the radar. And if like HRC just wants to have like, any kind of involvement in it, that I'll look to like keep you guys in the loop as it kind of morphs and takes on an actual like project. So anyway, that's all I wanted to say, was you guys actually found out about it before Arts Commission, because they don't meet for another like week and a half. So anyway.
Well, I think that everyone will be thrilled to be part of this as well. Too quick. Well, so I wanted to make a mention, Gina. Sonia arrived at 7:03. And then also Matt, gentle reminder, don't use words like lame in a context.
Okay. All right.
Just because totally ableist.
Okay.
But just, but also,
Sorry.
heck yes, I think we're totally wanting to be involved. Do you think we should have like a subcommittee, or do you think we should wait to hear more from you, or what do you think works best?
I think that is probably the direction that it'll go, is like a subcommittee of both groups. Mm-hmm. And like I said, I would love to retain the original involvement of the school groups. I just think there's so much creativity from our youth that I would prefer that they kind of drive the look and the feel of it. And so, yeah.
And
Anyway.
is this also, because I'm just maybe so ecstatic about how Albany Library is now fine free.
Yes.
And so it's also messaging for that and getting it out there.
Yep. Sure. Yeah.
That is so awesome.
Yeah. Anyway, so that's all I had.
Rad.
And I just wanted to say hi to everyone too. So
hi,
yeah.
you rock. Like seriously, the work you do online is great. And I love that you even respond in some of those groups.
Yeah.
Where people are like, wait, the city actually responded. And I'm always like, Matt is on it.
It's a little soul crushing at times, but it's necessary. So, but I do want to get out more to our citizen advisory groups and kind of touch base, because I know that a lot of, not necessarily you guys are pretty forward about like ideas about things that need to get out via the city's channels, but all of our groups are doing things that could be communicated in a more efficient manner. So anyway.
So also on that note, this is just another random question. I'm sorry to take your time up this evening. Okay. For our if we have an upcoming event, can we have you create it as like an event on Facebook? Okay.
Sure.
Cool. And we'll just get you like all the copy and like an image for it. Okay.
That's fantastic. Cool. Yeah.
All right. Well, have a groovy rest of your evening.
All right. Yeah. Thank you.
Thank you.
Thank you.
Thanks, Matt.
Yep. Bye.
All right. So let's move forward with item number 4, which is approval of the March 22nd meeting minutes. Do I have a motion on the floor?
I move to approve the minutes.
Second.
All right. All in favor?
Aye.
Aye.
Any opposed? All right. Sounds great. Okay, so let's move to item number 5. Looks like our first item is meeting format and frequency. Kim, do you want to give some color to this?
Sure. On mine, I see that Gayle's presentation is first. Are we able to go ahead and do that so that way we can really scale so that
yeah, I must be looking. Oh, I'm looking at an old email from Gina. I'm sorry, Gina.
Sorry.
I'm sorry, everyone. Sorry. Okay. Yes, let's go move forward with Gayle. I apologize.
No worries at all. So my name is Gayle Woodworth, and it's nice to meet y'all. I am the new Lynn County Harm Reduction Coordinator for the Public Health Department. We are just starting kind of regrouping our health promotions group. I've been there it's been 9 weeks, just a little over 2 months now, getting my feet wet, and I'm probably the oldest member of our team right now that makes up a lot of different things. So we are starting from ground zero. So Keith asked me just to come and tell y'all what I'm planning and what I'm trying to do for Lynn County. Real briefly, I grew up here in the Valley, grew up in Brownsville, went to school at Central Lynn Benton Community College, got both my degrees from OSU. So I definitely love this community. My family's here, my friends are here, my life has been here. So what I'm doing, basically, I work under an EISO grant for HIV prevention, and that's early intervention and services outreach. And within that, guys, I'm trying to sneak some other things underneath of it. Not sneak, just, work it so it's still palatable to being able to do it under my grant. My main focus right now, I used to work at the HIV Alliance down in Eugene, and I was a PWID outreach and testing coordinator there, where PWID, if people are unfamiliar, it's people who inject drugs, and primarily the unhoused. So I did 7 clinics a week. I went out with the needle exchange, and we were kind of a 2-person group, and we went out on the mean streets of Eugene and did our magic. So I do rapid HIV, hepatitis C, and syphilis testing anywhere. I can take my little bag and I can set up anywhere. Within that, I'm trying to establish now in Lynn County the mechanisms of if someone does become reactive, what are my steps? It's not exactly laid out like it was in Eugene. And so I've been doing a little finagling and trying to figure out the right providers and clinics and things like that. We don't have, well, and of course I have statistics because I'm one of those kind of people who love stats. So right now, according from 2019 in Lynn County, Oregon, we have males who are HIV positive, there's 42, and there are 47 males right now who are living with HIV or with AIDS, excuse me. And with females, we have, and I'm not going to break it down into, because that's kind of boring if I really get into it. But if we have, where's the females? The females, we have 29 that are living with HIV. And then let's see, how many are living with AIDS right now for females? I believe there's 8. So it's not hugely prevalent. I mean, it's not like in the bigger cities, of course, but still, I come from a background that everyone has a status. I don't care what your orientation is. I don't care what your age is. I don't care what your gender is. CDC recommends everyone should be 13 to 65. And what my message I want to really start putting out into Lynn County is that everyone has a status. What's yours? I want to destigmatize the HIV infection, because I look at it as with our medications we have now, it's just like having diabetes. It's a totally manageable infection or disease. And I want the generalized public to understand that now. So, because, you know, I could go back in the history, but y'all don't need to hear all that. Within that too, we'll skip off of HIV with my harm reduction. Right now, there's a scourge. I mean, horrible overdoses. Fentanyl, I don't know if y'all have heard, fentanyl's gotten into our drug folks that use injection, and the scary part now is that they're putting fentanyl in pills that look pharmaceutical grade. So we're getting more recreational drug users who might be college age, younger folks, older folks who just, hey, I'll take that perk from you and get high. They call them dirty 30s. They're printed just like pharmaceuticals. And the way I try to explain it real simply is that when you're making up a batch of drugs, it's like baking cookies. You make the dough, you dump the chocolate chips in. Those chocolate chips, you know, you think you're mixing them up, but when you put them on the pan, there might be 3 chocolate chips in one cookie and 10 in another. So you can actually take medications from the same batch that someone might have cooked up and be okay taking one pill and just get a really good high. And then the next pill can be lethal. So, and I'll tell you some scary stats between January of this year and the end of March. The overdoses that have gone into our hospitals. At Good Samaritan in Corvallis, there was 34 overdoses. At Samaritan General Hospital in Albany, there was 30. In Samaritan Lebanon Hospital, there was 28. And then Lincoln County, our neighbors, because I work with them a lot too, there was 6 and 15. All these are way too much, and it's only what we report, or what's been reported, like the EMTs and the police and that type of thing. So one of my goals is I'm starting to do 3 outreaches with folks who are unhoused and who inject. East Lynn County has been my primary, I mean, I'm in this 2 months, so I haven't gotten that far. But some of the folks I've just been talking to, they say, I talked to this one gentleman just this last week that told me in their camp alone, it's probably 2 overdoses a week. So, and now those are unreported. So our big push now is to get Narcan or naloxone out to our partners and these folks who are injecting. And I work with Shirley Bird from the Family Assistance. Oh gosh, I'm so terrible with acronyms. Anyway, she works East Lynn County in outreach. And so I'm partnering up with her. And eventually down the road, we'd love to have a needle exchange that's, you know, out there and everyone knows about it. We sort of have one that's, and I don't like to say underground because that's not right, but just for now, we aren't like shouting it from the rooftops. We're trying to ease it in. because it's very beneficial for disease prevention and to get these folks some help that they need. So that's kind of what I've been doing, just this trying to organize all that. And I've been to, and just going out to events. I make up safe sex kits, and I went to the Damn Straight drag show in Albany last month, which was fun as hell. I gotta tell you, it was fun. And I worked the crowd with my little basket, and I was telling them who I was and handing out condoms, and it was a lot of fun. And then I've talked with Keith, and I'm putting a really nice table together and a tent that I want to do testing at Albany Pride. So I'm gonna have HIV testing, and then we're gonna have some other part. I mean, we have a prize wheel, and we're gonna get these shirts, and so we're gonna make it a big deal and make sure that people know that Lynn County now, I mean, has always been part of the community, but I want harm reduction to be even seen larger. I think that it's needed, and especially with the, just the environment that we have now with these drugs. And yeah, so that's kind of what I'm sort of at. I don't know if you want anything else. I'm willing to come talk to people. I will do education classes for kiddos. I used to go, and I worked briefly in Idaho and did smoking cessation classes for kids who are incarcerated, teens. So I just think that education's huge, and I meet people where they're at. There's never any judgment. I'm like the least non-judgmental. I might not say things correctly sometimes just because of my age, and I'm trying to relearn my language and be articulate in that way and sensitive. But yeah, so that's kind of where I'm game, and I'm just ready to hit the ground running. Hopefully within a couple more years, I'll have this program. Like I said, I'm starting from not even a foundation. I am like scraping the dirt off to even put the foundation down. So that's kind of where I'm at now, and just get folks knowing their status, destigmatizing HIV, destigmatizing even people who inject drugs, these folks that just need a little extra help, and keep the disease down. Because I will say too, before I shut up, I might not see a lot of HIV in our unhoused and people who inject, though in the last 2 months, we've had 2 positive HIV folks in Lynn County now that has been reported to us. And it's hepatitis. That's the big one that seems to be rampant a lot through our injection drug users. And there's no reason we can't get them help, even if they're still, using. So that's kind of where I'm at. Let's just get people as healthy as they can and help them, and meet them where they're at. So that's kind of my thing. If you guys have any questions.
How can we help out? Do you need volunteers, or what resources, or what are your needs?
Great question, Stephanie. Seeing that this is just brand new, and I mean, I'm just setting up some of this stuff. I haven't even tested out in the field yet, only because I'm just right now making relationships. A lot of times when you do outreach or go out into this population, they are a tight-knit group. I mean, they're family, and they take care of each other. And when they see some person with a county badge, and oh yeah, we're staying the heck away from that person, So I'm just building relationships and letting them know that, it's cool and who I am. And I'm actually getting some folks out there that are helping me. So, and with volunteer, maybe during, my promotion team is very excited about doing Pride. And so I have a good group to do that, but I will definitely keep y'all on my radar if I ever need any extras for anything.
Kim?
Go ahead.
Just curious about your field testing. Is there a cost that gets passed along, or is that totally funded through Lynn County?
Completely funded through Lynn County and my grant. So when I got there, they had tried to start this position previously. The person wasn't a very good fit, I don't think. And then of course, COVID hit, and that person moved on to a different position that better suited their talents. So I had to buy I bought all HIV rapid tests. I got some Hep C, and then the syphilis. I'm not always going to do, unless people request it. Syphilis is really expensive, but I have the money right now. So everything's free of charge. And my naloxone kits that's the hardest thing trying to get right now is naloxone or Narcan. I've applied to Direct Relief that they give out free ones for organizations, agencies like mine. And it's just really hard to get naloxone right now, but I keep pushing. And the condoms and everything are also free. So yeah, everything is completely free to the people who need it. And also the help, because I can hook them up with the HIV Alliance. We have some provider that will help them with PrEP if they feel they want to pursue that, which is pre-exposure prophylactic. There's a medication you can take if you're not HIV positive that can help you up to 90% not get HIV. So it's the medications and the protocols and the regimens that people can do now regarding HIV, AIDS, even hepatitis. It's remarkable. I mean, hepatitis we can clear in 2 months now with 2 pills a day. So rather than like 6 shots and in the stuff, I mean, it's really we've advanced a lot in the medications. So, and I just want to get out there and let these folks know that. So.
That's phenomenal.
Yeah.
Can I get would you mind sharing your contact information? And
Oh, definitely. I'll type it in the,
I don't think our chat is disabled.
oh, okay.
I shared Gayle's info with Gina,
Oh, yeah.
so she should be able to
Okay.
forward it to all the members.
Yeah.
Perfect. And so we can reach out and
So yeah,
get
and
connected.
if y'all have any kind of questions, I mean, I'm on so many meetings. There's the high intensity drug trafficking area that we're with the police department. I'm trying to work with our own mental health services and alcohol and drug, the parole, the jails, to just get folks tested. And it's just really, like I said, my campaign is, I have a t-shirt that has a unicorn on it, kind of doing the little dad thing that says my superpower is fighting HIV. So that's kind of what I am. I just think that we need to destigmatize this and say, hey, so you have to take a pill every day. My partner has to take insulin twice a day. It's just it's going to be part of the normal healthcare. That's where I'm hoping before I'm out of this whole industry that I can see that. So
It's awesome.
thanks, I appreciate it. Yeah, it's been daunting a little bit. I mean, like I said, I'm only 2 months into this, but I'm passionate about it. It's something I truly believe in. So
You're going to make a huge difference. I'm excited to
thank
see
you.
where you're at in a year and in 2 years. This is awesome.
Yeah,
But yeah, would love to reach out and see how we can all help out.
oh, would love that. Definitely. So
Well, thank you so much for your time. Does anyone else have any questions or anything
Yeah,
else?
I do.
Yes, Keith.
Gayle, I was going to see if you knew of any resources for people who have friends or family with substance use, where they can get testing kits to test their
oh,
narcotics for fentanyl.
you know, we had some fentanyl strips, which I will tell you right now, Keith, is as hard as getting Narcan and naloxone right now. But I'm going to look into that again with the Oregon relief. And they're very hard to get back to. And I've been gently being a pest. I guess that would be, yeah, gently pestering them without being obnoxious. And I can definitely get back to you on that too, because I know fentanyl strips do help with this, but there are some caveats to that as well because of the way it's harder to test pills. You can test your heroin and your meth with it, but pills are a lot harder because you can scrape off one side, but the fentanyl may all be concentrated on the other side of the actual pill. And the real scary thing that I find disheartening is that younger people, not just our experienced drug users, we're finding it in not even meth, it's in methamphetamines, in heroin, it's in ecstasy, it's in pills that look like what your mom might have taken for a knee surgery that you might finch out of the medicine cabinet, or what you might have had at one time. And that's the scary part. And we're even finding cannabis laced fentanyl smoke, and not from the dispensaries, obviously, but I mean, if someone gave you one at a party, I'm very much about the education and letting people know that this is out there. And I had a meth person who uses meth, and she told me that she took her normal hit and went down. And so it's simple as like giving out, don't use alone. We have an 800 number that you can call if you're by yourself. And you want to, use, and that person will stay on the line with you through the whole time. And if you don't respond to them, they will, contact someone to come help you. Just really simple things, don't use a loan, don't share equipment. And that's why it's important for me to eventually get a needle exchange. Is just, it saves so much in, and I always think fiscally as well, not only humanitarian, but fiscally, it helps with, if we have less infections, we have less street folks who are using the emergency room as their primary care. They come in with sepsis or MRSA, which I have seen on the street, and it's awful. If we can get them to not even get those, then we're saving so much more on the other end of the health industry when it comes to actual, primary care and first responders. So that's my argument as well too, when folks don't like the.
Did we lose you, Gayle? Did everyone else, did Gayle freeze for everyone else? Greg, I noticed you unmuted yourself. Did you have a question for Gayle as well? Maybe we can email it over, or you're muted now. I apologize.
Is that better? Can you hear me now?
Yeah, I can hear you.
Okay. No, I was just going to share with Gayle before she left us that our dental clinic in Eugene works with the Alliance of the HIV patients. And if she has any referrals to other dental needs, we'd be happy to help them down there as well, because we're pretty aware of the working with the Spins and Alliance. So if we could pass that on to Gayle if she comes back, if she has any of her acquaintances or clients that need any dental concerns, that we'd be happy to help.
It looks like Gayle's back on. So perfect.
So dental, you said dental clients, Dr. Serrano? Dental clients? Oh, I'm frozen again. All right, we'll see you later.
I can't hear, sorry.
Sorry.
Okay.
I'll go. My internet's probably crap out here. I live out in the country, so.
Well, we'll get your information, and I'll make sure that you and Greg are able to connect.
Awesome. Thank you so much for inviting me tonight. Y'all have a great meeting. Thank you.
Thank you, Gayle.
It's good to meet y'all.
And Gina, it looks like we lost Miriam as well. I'm not sure if that needs to be reflected in the meeting minutes as well. And it looks like we still have quorum though. I think we lost her around 7:27 or 7:28. Okay, so our meeting format and frequency. I know we covered this a little bit last meeting. We were talking about maybe changing the day or the time. You want to kind of take over on this, Kim?
Sure. And Greg, I apologize as I'm the one who's muting you. Just your awesome background is doing some funky feedback. So please don't take it personally.
No problem.
All right. So thank you all for responding to the survey, the email that went out, and it was pretty unanimous. Folks want to keep with the fourth Tuesday of the month. Folks have cleared their schedule. They know it's going to happen. Awesome. While there were a couple folks who said they wouldn't mind going earlier at 6, pretty much everybody said it's not a problem to continue on at 7. So I think moving forward, we're meeting on the 4th Tuesday at 7 p.m. So then the next question is hybrid, in-person, virtual. Since the last time we met, I am happy to announce that community development has purchased what are called owls. And so they're able to make pretty much any meeting room hybrid compatible. And so if we're interested, we could start doing our next meeting hybrid. And that way folks who want to show up in person can, or folks who want to stay virtual are as well. Gina and I will figure out the technology. We'll get the owl, clearly they're named. So just want to share these. It's Albany and Owlsworth, because this is what we do to keep our sanity in public government. So yes, so if folks want to go that way and don't mind the hybrid format, then that's what we would move forward with doing. How do folks feel?
I'm open to hybrid or, sorry, apologies. Keith, go ahead.
I was going to say hybrid's great, and I've used that owl in meetings, and they're really, really handy.
So if we were to, so let's just see how this would go. If like someone wanted to come in person, do we need to have like, hey, let Gina or let someone know, you know, like a week in advance, 48 hours in advance? What's the plan for that?
Sure. So in order for us to have a presence on site, Gina, I apologize. How much prior to a meeting do we post public meeting the agenda?
I put it, like I send it out the week before. So we would have to, like I tried to get it out the Tuesday before. Sometimes it doesn't happen until Thursday or Friday. So it'd be good to know the Monday so that we could write it up on Tuesday and get it posted out there.
Because what would happen is if we know nobody is going to be there on a Tuesday, everybody's going to go virtual, then we'll be able to make adjustments and not have building security and all that kind of good stuff. So, so in looking at the calendar for next month, our fourth meeting would be 3rd, 10th, the 24th. So you would need to let us know no later than the 16th if you will be in person. And that way, if we don't hear anybody saying they're going to be in person, then in all honesty, we'll probably say just straight virtual in order to save some security resources. Does that work?
Yeah.
So Gina, do you mind on upcoming agendas then, or when we send out the minutes saying, you know, your amazing email that you send out asking for information, just adding the new line saying you need to let us know by 5 p.m. or whatever time works for you.
Sure.
On that Monday in order for us to message appropriately.
Yeah, that's good.
Cool. Well, awesome. Nice work, folks. So then the last part is frequency. So you may or may not have, I know a lot of folks are attached to different citizen advisory groups. There is some conversation going on with City Council about streamlining maybe down from 19 to 16 groups, just so that we can be more modern, more efficient, and make citizen advisory groups potentially a little bit more meaningful and substantive for some of our groups that might not have things to meet about on a monthly basis. HRC, I think there's lots of opportunity for all sorts of topics, but I wanted to check in as pretty much with every group that folks are running. The question is coming up. Do you feel like monthly is important to this group? Do you want to go every other month? Do you want to meet 8 times a year, 10 times a year? Some groups have issues with quorum, some have issues with which we've had a little bit of a rough streak here and there, but I feel like we're rallying. So I just kind of wanted to throw it out there to see for this group, do you want to continue to meet monthly, or do you think there is another magical number that would pack in meaning and provide an adequate balance for this group?
Side note, Gina, I wanted to mention that Jamie Jones has joined the meeting at 7:34. Keith.
Oh, I was just going to say, I like the 10 meetings a year format. That way we get December as a break, and then we have another option to skip a meeting if we need to.
I was going to be maybe the outlier and say it'd be great to meet more frequently. But what does everyone else feel? Would love to hear. Robin?
I could go with the monthly meetings. I think that's a good amount. 10 would work too. But yeah, I think monthly is where I would vote.
Greg, Sonia, Jamie? I'm seeing shoulder shrugs and
Just as a visitor, I don't know if I have a say. I think it's great what you all are doing, and if you could do it more often, that sounds great.
don't have too much background noise, but otherwise, I like to format the 10. It's okay with me, what we've been doing, so I vote for the 10 with the winter break.
If it's just the winter break, that would be 11 though, right?
And in all honesty, that fourth Tuesday does fall pretty much either Christmas week or, and so maybe as a compromise, we do 11 at this point and kind of see how material continues to flow, how quorums are working, and maybe revisit in 3 months just in case anything has changed or we see how summer rolls out. That's what we're doing in some of our other committees. Would that be okay?
Mhm.
Okay, so at this point, we're going to officially say we're 11, no December meeting, and we'll reevaluate in 3 months.
Also, I want to clarify, I'm not sure, Gina, if Sonia, we have a new member that I have not met yet that is named Sonia, and I thought that you were her. And I apologize. So Gina, I'm not sure if you marked down that this was our new Sonia. That was just appointed.
Well, I thought you knew something I didn't know. So
I saw in our roster that we had someone named Sonia, and I was like, oh, great, she's here. I was like, oh.
Just another Sonia, sorry.
Okay, so for a brief moment, we did not have no, we did quorum. I need to count myself. Okay, just kidding. Okay, we're good. Sorry, but it's great to meet you.
Yeah, thank you for joining. So as far as meeting format and frequency, thank you all. I feel like we went through that. It's pretty succinct, and we'll go from there.
All righty. So our next item on our agenda, HRC project updates. I have 2, but does anyone have anything before? Robin, did you want to go forward?
Yeah, I just wanted to mention that I've been sick for a few weeks here, so I'm a little bit behind, but I did start to do some research on what other, cities have, municipalities and things have done with regard to food trucks and stuff. So I need to get a hold of Miriam yet and Jamie, and we need to meet up on that or kind of communicate on that. So yeah, I'm behind.
All right. Anyone else have anything on their projects? Okay, so I have 2. So I had the opportunity to meet with Jolene Thompson. She's the chair of the historic commission. What is it? Landmarks. There we go. And we did so much research and looked through all these fun digital files of old ads and figuring out the first woman-owned business, first Asian-owned business. Did you guys know we already have had a Jewish mayor? And so we've marked out this huge. She was trying to come, but she's cleaning up for an event for work. But we're trying to solidify a date. We've decided on 10. We might cut down to 8. First Black-owned business, first Jewish business, for for a walking tour during Historic Preservation Month. So we're gonna have it be either a self-guided tour, have that people to be able to do that, but then also have maybe 2 tours where we can do them in person. So those dates are TBD. We're working through them, and so I'll keep you guys all abreast on that. But Historic Preservation Month is next month, so once we have those dates solidified, I'll get them over to you guys and to Matt. If anyone wants to volunteer and go through and do any tours, I think they're fun. But also, I don't think there's anything such thing as a stranger. Everyone's just a friend I haven't met yet. I know that's not everyone's personality. So, but yeah, so we're excited, and it was a lot of fun to go through all that. And then the second thing is I'm going to send this over to Kim. If people would like to sign up, I'm going to be bringing back the, I'm going to try to do this ideally every other Saturday. Realistically, might be every 3rd Saturday. Having the HRC table at the farmer's market and having a topic of discussion. So if you'd like to sign up, I'll get a sign up form with topics over to everyone, and I'll create lesson plans. They'll be really short and to the point. But so Kim, I'll send you over that information probably by tomorrow afternoon. All right, and then item number D, event debriefs and potential event involvement, and the Juneteenth celebration. Kim, I know you emailed me over details on this. Do you want to take over on this?
Sure. So the organizers for Juneteenth it's going to be a Albany Corvallis event held at LBCC. The NAACP is involved, and they have a gal who is coordinating the event. And they came to the city and asked for some financial support, which unfortunately we are not financially in the position to provide. But I did say that we have the HRC here, and that it might be something that this group would be interested in helping to promote, potentially volunteer at. And so I just kind of wanted to let you all know that it is happening. I can send, if we want, we can, if we want, I can ask the coordinator maybe to come to our next meeting and kind of give a bit of information and see if there's any way that we can help engage. They're just really excited that we're having this celebration in the community. And it seems like something that the HRC would potentially want to be involved with and have a presence on site.
Awesome.
So
that sounds great.
the fun thing about that is Juneteenth is the week before Pride. So I've been working closely with Jason and his team over at the NAACP, and we'll be partnering with them. So we'll have events both at their event, and then we'll have them at Pride. So it'll be a really fun kind of intersectional exchange we'll have going on.
Awesome.
Would this group feel comfortable? Oh, I apologize.
Oh, no, go ahead.
If we do get promotional material from LBCC, I imagine that it would be okay for me to say HRC is in support of city resources going towards advertising on social media and the website.
Yes.
Okay, just want to make sure I'm going through the formalities here and that I'm not making any assumptions. So yeah, I'll go ahead and work with Matt, and I believe her name is Margaret. So that might be incorrect, but I'll work with the coordinator and see if maybe we can get 10 minutes at our next meeting.
Awesome. And Albany Pride, remind me, that's the 25th of June?
Always the fourth Saturday.
Okay. Well, Kim?
Keith, I know it's your event, but for Pride, last year the city had 3 tables. There was one for HRC, for Parks and Rec and City Manager's Office, one for Fire, and one Police. This year, the library has already asked Keith if they can have a booth. So I reached out to Keith and said, hey, the city's a lot. We're excited that we have so many departments, but we're taking up a lot of real estate. So as a result, this year, I think we're going to do a 10 by 20 and shove all of us interested parties in one area. So, so I imagine HRC will continue to want to be on site. When the time comes, we'll put together a little subcommittee for the city for each one of those representing departments, and we'll figure out how we can complement each other and just have a really rad booth.
And I can get my Mr. over to you guys as well.
I will let Matt know. He was asking already.
It's a lifesaver. It's like just a misting.
It was so hot last year.
Right. All right. So highlights from this meeting for our annual report. Anyone would like to bring anything forward? I
really liked Gayle's presentation.
I agree.
And I'd like to have her back like in a year and see where we're at with everything in her programming.
I think that would be incredible. We should send her an invite. She'd be like, so what are you doing this time next year? Hanging out with us. I think it'd be great. Yes, I think highlighting Gayle and her incredible presentation would be an awesome highlight for our annual presentation. All right, so moving over to staff updates. Kim, you want to take it away?
Sure, not a ton that I haven't already talked to you guys about. The Citizen Advisory Group conversation continues with City Council. I don't know when the next time it'll come back up on the agenda. If it's before our next meeting, I'll try to remember to send out an email to say, hey, tune in on this day if you're interested. Other than that, a lot of departments are recruiting. So if you know folks in any capacity, if they're looking for part-time work, full-time work, Spanish speaking, just anything, please, 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 please send folks our way, as we want to make sure that our workforce is reflecting our community. And sometimes we fall short on that. And so, so yes. And then other than that, I am on countdown for, well, not really officially countdown, maternity leave. I will theoretically, hopefully have 2 more meetings with you all before I go away for 3 months. I'm not 100% sure who's going to take my place at this point, but I'll be able to announce that at the next meeting. So I keep surprising a lot of people now that folks see me in person. They're like, I didn't know you were pregnant. So I am trying to do a better job of saying it more often so that I don't catch folks A, by surprise, and that B, when I vanish, you're not thinking I'm a flake. So, so yeah, I just wanted to let you know I'll be identifying an alternative who will be coming in for the summer. So keep you posted. And that's all I've got.
That's so exciting.
Awesome. I wanted to make a note, since Jamie is here, I thought it would be a good idea if some members of the HRC met with the city manager to talk about the creation of a position for someone to work in diversity and inclusion for the city.
I think it'd be awesome too.
Yeah, that'd be awesome.
So would that be like a subcommittee? If you want to go forward? Am I hearing Robin, Keith, and Jamie, you want to do that?
Mm-hmm.
You guys are gonna hang out with our buddy Peter?
Sure.
All right, sweet. I'll let you guys reach out to him, and I would love to hear what he says at our next meeting, which is on Tuesday, May 24th, 7 p.m. virtual or remote or hybrid.
Hybrid location physical location inside of City Hall to be determined.
Let Gina know by the 16th. But yes, Sonia, did you have anything that, since you're not our member of our HRC, that I thought, did you have anything you wanted to bring at all, or?
Well, I didn't know really how much time, you all spend. I did visit once before, one meeting before. Miriam, encouraged me to come and share an event that the Baha'i community is planning. I can share if there's time, but if not, maybe.
Sure.
Okay. Yeah, so there's a small but active Baha'i community in Albany. I don't know if you're familiar with the Baha'i faith, but it's a global faith, and there is a small group here, including many people who consider themselves Baha'is and many people who just like to work together with like-minded people. And so the kind of world governing body of the Baha'i faith, the Universal House of Justice, has encouraged Baha'i communities all over the world, in every country and city and even neighborhoods, to host kind of local conferences and invite, as many people who are interested in kind of the well-being of humanity as a whole. But oh, the baby is so cute and distracting. I forgot everything I was going to say.
Community as a whole.
Yeah.
Sorry.
Just basically spaces. We're calling them conferences. They might look more like festivals of the arts or celebrations, spaces where there's discussion and, family friendly, encouraging people to come together, especially as COVID is starting to get a little bit more manageable, and just to kind of celebrate that we are a community, so celebrate our diversity. And the message that the Baha'i community is always kind of putting out there is that we have a vision of the future of humanity that is hopeful and peaceful and safe and just and equitable. And we think that that vision is shared by a lot of people in the world, of all different backgrounds, faith-based or not. And so, yeah, so we when I was sharing this with Miriam, we kind of had a small vision of a number of families who are already in some way associated with the Baha'i community. And she said, think bigger, like our whole community would probably be interested in a space like this where, we could come and hear a little bit about the Baha'i community's vision of the future, but also discuss and experience, kind of looking ahead, looking to, our younger generations. What is this community that they're inheriting and how will they be empowered to contribute to its betterment? And kind of looking back at how far we've come, I was excited to hear this research being done about, how our community of Albany has become more diverse and hopefully over time has a lot of work to do, but hopefully more and more inclusive and welcoming. But to be able to kind of honor that history and then also think together really what is possible, how to work towards both kind of material and spiritually healthy community life. So, we have a simple plan. Again, we were going to just do it kind of we had a vision of like 50 to 100 people. And Miriam said, maybe you could do it in a more prominent location. Maybe you could, have a broader invitation and get it out there a little bit more. And you might be surprised. There may be many who would like to join such a space. So anyway, she just encouraged me to share with the HRC. And so that's what I'm doing. And I'm happy to answer any questions. It is coming up soon, just the first weekend in June. We're still determining exactly how much time, it may be a number of days, kind of the program and the format. We're trying to get a lot of input from a lot of different people. So yeah, that's kind of where we're at with it. I'm sure it's not a very polished presentation of our intention, but that's the spirit anyway.
No, that sounds great. If you have Gina's email address, I believe it's just on is it Gina.Buress? I'm going to say her last name incorrectly. You can send over any
at cityofalbany.net.
You can send over any information for the event. We can get it on the HRC calendar as well.
And I did get a flyer from Miriam regarding this.
Is that the same flyer? I think that was a different flyer.
Yeah, I think so. She had this idea of creating these spiritual conversation gatherings once a week on Fridays. So that's separate but related.
Oh, okay. Okay.
And I know Miriam, she emailed to say she had to leave early tonight. That at our next meeting, she'll bring it up. It's something that she is interested in putting on, and that she wants to see if maybe the HRC, kind of like with Steph tabling at the farmer's market or the Unity Walk with Greg, if this is something that the HRC would be interested in backing and saying, yes, this is an official HRC thing. So that'll be coming back at our next meeting.
Excellent. Jamie, I did not know that you had a little baby too.
Yeah, she came a little early. She's 2 weeks old today. She wasn't due until the 6th. So
congrats.
It's been kind of a wild month this month.
Congratulations.
Thank you.
All the babies. I love it.
Yeah.
Awesome. All right. Well, our next meeting is the 24th. So with that, I'm going to go ahead and call us adjourned.
Good night, everyone.
Have a great one. Thank you all.